Hi, everyone, and welcome to the Colorado State University Prevention Extension Cast. I'm Dr. Nate Riggs. My preferred pronouns are he, him, his, and I am the Executive Director of the CSU Prevention Research Center. I'm very happy to be joined by Dr. Jonah DeChants, who is a research associate at the Trevor Project. Now, Dr. DeChants earned his PhD from the University of Denver's Graduate School of Social Work. He uses community-based research methods to study the experiences of youth and young adults experiencing homelessness, particularly those who identify as lesbian, gay, bisexual, transgender, or queer, LGBTQ. His dissertation is entitled Between a Rock and a Hard Place, a grounded theory exploration of queer and trans young adults navigating family rejection and housing instability, and examines how LGBTQ youth survive family rejection of their LGBTQ identities and housing instability. Dr. DeChants has published over 20 articles in journals including the Journal of Primary Prevention, the American Journal of Community Psychology, Social Work Research, and the Journal of Gay and Lesbian Social Services. So a lot of really nice cross-disciplinary work. Now, Dr. DeChants has worked for the Philadelphia Department of Human Services, supervising federal planning grants, which examine the risk and protective factors of homelessness among youth aging out of foster care. He has also worked for the LGBT Center at the University of Pennsylvania and Seeding Change of Kalamazoo, Michigan. He earned his Master's of Social Policy from the University of Pennsylvania's School of Social Policy and Practice and his Bachelor of Arts from Kalamazoo College. So he boasts a lot of experience from a lot of regions around the United States, and I'd be really interested to hear about any similarities or differences in those experiences in the space that we're going to be talking about today. So interestingly, and I didn't know this until yesterday, Dr. DeChants was a postdoctoral fellow at Colorado State University in the School of Social Work. So he's got some local roots as well. And the PRC actually has a lot of partnerships and faculty affiliates in that school. So it's great to talk to him. Now, for those of you who have yet to join us for a Prevention Extension Cast, I'll be moderating a 45-minute Q&A with Dr. DeChants about substance use and homelessness among LGBTQ youth. Now, after that, we'll have some time for our guests to respond to any questions that emerge from the audience. So throughout your conversation here today, as always, please feel free to enter those questions into the Teams live chat, and I'll relay them to Jonah near the end of the cast. And as always, I'd like to thank the National Institute of Food and Agriculture for providing funding for the Prevention Extension Cast. So let's get started. How you doing, Jonah?
Hi, I'm doing well. Thanks so much for having me.
Yeah, great. Well, thanks for joining us today. Can you please tell us a bit about yourself? What is taking you to all these places around the country, and what got you interested in doing the research that you do?
Yeah, absolutely. Let's see. How did I end up in all these places? That's a great question. I'll just sort of run through the winding path that has been my career. So I grew up in Michigan, attended college there at a very small liberal arts school where I studied political science and French, of all things. After college, I graduated and worked for a very small nonprofit that did a lot of youth programming, and that built out of a lot of the work that I had done before. I've done a lot of work with kids. I worked at a science museum as my first job in high school. I was a camp counselor. I've been a first grade paraprofessional in the classroom. So after college, I was still working in youth development, and then but primarily switching from a youth role to a training adults role. So trying to train adults about how to work with young people and how to work with them in ways that were empowering rather than just sort of top down, I'm the grown up, I'm going to tell you what to do. That's sort of what initially got me interested in social justice, because a lot of our programming with young adults was around questions of social justice, both in their own communities and then across the world. That was also a role where I first started to work on LGBTQ issues. We authored and designed a curriculum specifically about LGBTQ issues for high school students. After that, I moved to Philadelphia. Honestly, I mostly wanted to get out of Michigan. That was the real rationale on that one. And I wanted to live in a big city. I wanted to sort of have that experience. And that's how I ended up at grad school at the University of Pennsylvania, where again, I specialized in LGBTQ issues, genders and sexuality. It was as I was getting ready to leave that program, actually, that I started looking at homelessness. It was actually, someone asked me this recently, and I was reminded that it's kind of accidental. I was originally very interested in working with LGBTQ youth again, and we had to have an internship in the master's program I was in, but all of the internship placements for LGBTQ organizations were already taken. And so I was like looking through the list of organizations that my program had worked with, and I found an organization called People's Emergency Center in West Philadelphia, which is a housing and community development organization. So they offer several housing programs, emergency housing, transitional housing, primarily for women and families. But then they also do some larger sort of neighborhood development, job training for folks in the community, things like that. That was an amazing internship, and it was something that really opened my eyes to the housing services world. And in particular, myself and some colleagues during that summer that I was in that internship were really interested in thinking about how young people were not being included in shelter services. So at that point, a lot of the families that were entering our shelter, a lot of them had older children who were teens, and then they had also young children. And so when they knew that they needed to go into housing, sometimes they would take their teenagers and they would send them off to live with family members because they weren't allowed to come live in shelter, especially the young men. Which is, it's not legal. It's not legal to discriminate against young people based on their gender, but because it was a space that was serving so many women who had experienced intimate partner violence, it was an uncomfortable sort of situation, and a lot of young men didn't feel comfortable in the space, and then a lot of families did not feel comfortable with them there, and so these families were being forced to split up, and that also meant that the teenagers were not getting any services, right? And so they're technically homeless, and they're couch surfing with other friends and family members, but they are not connected to any kind of service provider, and that sort of led to a larger problem that we noticed in the Philadelphia community is that so every community does a point in time count every year for folks experiencing homelessness. It's a way of allocating funding and trying to understand, how many folks in the community are experiencing homelessness. And folks in Philly realized that we were only counting like less than 20 young people, like folks in sort of that age 16 to 24 age demographic. And Philadelphia is what, maybe the 5th or 6th largest city in America. There's no way we actually just had 20 young adults experiencing homelessness. And so what we discovered is that it was due to this pretty big cultural shift where most young people did not feel comfortable stepping foot in an adult shelter, right? They didn't want to be in those spaces. They didn't feel safe in those spaces. And so instead, they would couch surf. And so they would stay with friends and family, and they would sort of rotate. And so for many of those young people, they didn't consider themselves homeless. That's not their perception of their housing stability. But at the same time, that is a destabilizing experience to not have a permanent location. It's hard to get a job if you don't have a permanent address. It's hard to stay connected to school or employment if you have to keep figuring out your transportation at every new place. So all of which to say, sort of coming back to your question about regional differences, that was a big thing that was fairly unique to Philadelphia. And then when I moved to Denver for graduate school to continue studying homelessness and housing, I discovered that because we have a different culture here, we have different weather here, we have a different sort of geographic layout as a city, we're much more spread out. There actually are many, many, many more young people experiencing street homelessness here in Denver. And so there are more young people living outside. There are still folks couch surfing. That's still definitely a phenomenon in our community and something that we should be really mindful about. But that was just sort of a big difference that I noticed right away, especially because at that point I was coming to Denver to study at the University of Denver. Let's see, sorry, to wrap up sort of the journey, I finished my PhD in 2019, was a postdoc at CSU, thrilled to virtually be back on campus here today, and then ended up at the Trevor Project where I am now.
Wow, thanks for that, Jonah. That's a lot of really great experience, and it just makes me think about the critical role that community-based participatory work does. And so I want to put a pin in that because I want to kind of come back to that. It sounds like you have some really great experience working directly with communities. And so I've got a couple of questions that I want to ask related to that. Before we get to that, though, can you tell us about the Trevor Project and what got you interested in research and the research that you're doing there?
Absolutely. So the Trevor Project, for folks who are not familiar, is the world's largest crisis services organization for LGBTQ youth ages 13 to 24. And so what that looks like is we primarily are best known for our crisis services. And we have sort of 3 avenues where folks can approach us for services. We have a call line, a traditional sort of phone hotline. We also have a chat crisis line, and then we also have we have a text feature and then a chat feature on our website. So those are our 3 largest programs. In 2021, I believe we served over 200,000 crisis contacts. So we are talking to young people 24/7 about how they're feeling and trying to de-escalate some of the crisis and the acute mental health symptoms that they're experiencing. Our less well-known programs, we also try to do some prevention, trying to make sure that folks are not getting to a point of crisis. So for us, what that looks like is we have a small but mighty advocacy team. So we have folks who are working with state and local partners to try and pass legislation, both sort of general LGBTQ youth protections, right? So making sure that folks have, fighting some of these bad bills, especially the bad bills that we've seen in the last 6 months, attacking trans and non-binary youth. So advocating against bills that ban trans kids from sports, any bills limiting young people's access to gender-affirming healthcare, things like that. Then also trying to pass, good bills, right? Trying to make sure that we're protecting folks' rights. So we have been successful in passing conversion therapy bans. Conversion therapy, for folks who aren't familiar, is any sort of therapeutic practice or even informal therapy that seeks to change someone's sexual orientation or gender identity. And that has been banned in several states across the United States. It's also been banned in Canada. And so we've passed some of those bans. And then we also try to advocate for suicide prevention resources in schools as well. So making sure that, educators and folks working with young people have access to mental health first aid resources and understand how to implement that and have those conversations with young people. We also do education and training. So we have, again, a small but mighty team of folks who train organizations. And again, that's sort of, we do LGBTQ one-on-one for folks who want to learn more about the community and particularly how the community looks among youth. And then we also do mental health first aid, sort of crisis intervention training. And then finally, we have a research team, and it is our goal to really sort of bolster all of this work with research. So we primarily, we run a large survey every year. It's the National Survey on LGBTQ Youth Mental Health. We actually just released the 2022 National Survey in May. Let's see, and it's a 150 question survey. And the goal is really to try and understand, what are all of the different factors that can impact our primary variable, which is suicide risk, right? So we certainly ask about suicide risk, we ask about other mental health symptoms, but then we also ask about all sorts of other experiences, right? We ask about family support, friend support, how affirming your school feels, all sorts of different environmental factors that we think may impact a young person's mental health. And that was what really got me interested in Trevor. I have been very sort of aware of youth mental health in the LGBTQ community, especially having worked with LGBTQ young people experiencing homelessness. Mental health, substance use, housing instability are all sort of twisted together in the experiences of so many young people's lives. And so for me, it was an exciting opportunity to come work with a large, exciting data set. And for me, a big part of the draw was being able to work in an organization where I can do data and then I hand it to the advocates, right? And then they go out there and they hand it to lawmakers and decision makers. So feeling like it's a little bit, I don't want to say closer to real world impact because you can have a lot of real world impact in the academy as well, but feeling a little bit more connected into the LGBTQ movement, I think was a big part of the draw for me. And I think both informs our research, it informs what we ask about, and then certainly is the place where we disseminate our findings.
That actually leads into my next question that I had for you. We have a lot of graduate students who view this, the Prevention Extension Cast. And what we're finding is more and more these days, people who are in their PhDs, they're choosing to go into non-academic positions where they can work more directly with communities in some cases. So, you're talking about all the great community-based prevention research or community-based work that you're doing. What were some of the factors, you've alluded to some of them so far, but what were some of the factors that influenced your decision to work with the Trevor Project versus going into academia?
Yeah, that's a great question. Let's see. I mean, I think And I can't speak to, I'm always happy to chat with other PhDs who are deciding to go in the academy or outside the academy, and I love sort of hearing everyone's story. I'll certainly only speak for myself. I think for me, it was a combination of both a push out of the academy and a pull towards sort of industry or nonprofit, right? And I love the academy. I certainly, I wanted to be in a tenure track job. It was something that was very important to me, but also it is still very difficult to be a marginalized person in the academy. So for me, particularly as a transgender person, it was tough. It was tough to be the only one in the room almost all the time. And so for me, I reached a point where working in a space that was more predominantly, in an LGBTQ organization, knowing that I wasn't going to be the only one was a big part of the pull as well. But like I said earlier too, there's also this sense of feeling a little bit more connected to sort of real world advocacy, right? And again, it's not a slam on the academy. You can still have lots of important impact publishing and working in the academy. I particularly really miss teaching. I think that was a really impactful part of the job. But for me, this opportunity, again, sort of to work with advocates, right? To be able to Slack someone on the advocacy team and say, okay, what do you think are the important questions that we should ask on next year's survey? What is the data that would allow you to make compelling arguments when you're talking to lawmakers and decision makers? And then being able to hand that back to them, right, is really satisfying. So yeah, I think there's that. I think there's also, we are increasingly in a data-driven society, or hopefully, right? There are other parts of our society that sometimes do not feel very data-driven or evidence-based, but many corporations and organizations are trying to make more data-based, insightful decisions. And so for PhDs, we have that experience, right? We have that experience of organizing data, of trying to find insights. And so I think it's a skill that's in demand and can be really impactful wherever a person chooses to work.
Well, I mean, it's clear that you're able to continue to do really strong research outside of the academy. I'm wondering, what are some of your current research projects that you and your team are working on, and any interesting findings that are emerging from those projects recently?
Yeah, let's see what have I been doing recently. We actually just today are releasing our June research brief. We do a short 2 to 3 page brief every month, and our June brief is about resilience. And so we use the brief resilience scale, if folks are familiar with that one, and we're sharing those results. Let's see, was there anything surprising? It wasn't surprising, but it was fun to see that resilience is a strong protective factor. And so for young people who fell in sort of our high resilience group, those folks were much, much, much less likely to report recent anxiety, recent depression, suicidal ideation, or a suicide attempt in the last year. So that's exciting. We did see some demographic differences. Young people who were lower income, lower SES, those folks tended to have lower resilience. Young people who were younger tended to have lower levels of resilience, perhaps due to the fact that they haven't had as much time to sort of develop coping mechanisms and develop sort of the brief resilience scale. Specifically, it measures sort of bounce backness, right, and this capacity to kind of bounce back after a challenging situation. And so I think when you have our sample is age 13 to 24, and when we think developmentally about the difference between where you were when you were 13 and where you were when you're 24, we frequently see pretty significant age differences just due to brain development and all of that. Yeah, let's see what else. We have, let's see, earlier a couple months ago, we published a publication in the International Journal of Environmental Research and Public Health about access to changing your legal documents. So for our trans and non-binary young people who said that they wanted to change their legal documents, having access and being able to do that was associated with lower suicide risk. I'm currently working on an R&R for a manuscript around trans girls' participation in high school sports. So, and that's a qualitative paper actually, where we sort of pulled out, we were able to identify young people who identified as trans girls who are currently in high school, and then we asked them, why do you play sports? Why do you not play sports? And we got a lot of really interesting, to me, the sort of most surprising or interesting finding, I was so focused on the bad parts, right? I was so focused on discrimination, which definitely showed up. A lot of young people told us they didn't feel safe participating in sports. But the positive information was also very powerful, right? And it was all this, I play sports for my mental health. I play sports to stay physically fit. I play sports to hang out with my friends. I play sports to have fun, right? All of the same reasons that other kids play sports, right? And the fact that young people can really articulate that, particularly for me, the mental health piece of that, I don't know, this is my own personal hypothesis, but I think young people today are so much more mental health literate than I was when I was their age. They have so much more language to describe what has positive and negative impacts on their mental health. So that was very exciting to see. So that's just a small sample of some of the work we've been working on.
That's great. Yeah, thanks for sharing that with us. So, you talked about resilience, and as you know, the number of people who feel comfortable identifying as LGBTQ has increased over the past few generations. But at the same time, people who identify as LGBTQ remain disproportionately affected by substance misuse, other behavioral and mental health concerns, homelessness. Can you describe to our audience what you are seeing in terms of the disparities between LGBTQ youth and non-LGBTQ youth in these outcomes?
Yeah, for sure. Let's see. First, I'll just sort of say that our sample only includes LGBTQ youth, so I'm not quite as up to date in my comparisons between those two groups. But that being said, the literature absolutely shows that yes, LGBTQ young people are much more likely, or much disproportionately represented among young people experiencing homelessness, right? So we estimate that LGBTQ young people could be anywhere between 1% to 5% of the general population, but they are consistently assessed to be anywhere from 25% to 40% of young people experiencing homelessness. So that's a very large disparity. Like you mentioned, substance use is also something that is a big factor. LGBTQ youth are also more likely to be in foster care, which again is starts to become this sort of cycle of instability, substance use, mental health symptoms that can then very quickly sort of bleed into one another. I think coming back to the first part of your question about sort of how more and more people feel comfortable coming out, I think we are at a very, very interesting and sort of paradoxical moment in LGBTQ rights, where on the one hand, we are more protected and exponentially more visible than we ever have been certainly in my lifetime or in like recent American history. The flip side of that is that but that doesn't necessarily mean that homophobia and transphobia are gone, right? And so there are still, and certainly now in the last year and 6 months, we've seen this huge legislative backlash, right? We see bills trying to limit the discussion of LGBTQ issues, the most famous one being in Florida, but a lot of folks here in Colorado may not know that our State Board of Education is also trying to limit discussion of LGBTQ issues in Colorado schools. And I think what we're seeing now, frankly, is there's a lot of, I think many folks are uncomfortable with the idea of LGBTQ children and young people. There's this sense that LGBTQ young people are too young to understand their identity and too young to express their identity. There is certainly fear. A lot of people have this sort of misguided idea that being LGBTQ is contagious, and that if their child is exposed to these ideas, that will make them more likely to be LGBTQ. There's no scientific evidence supporting that. And so, that we're in this paradox, right? On the one hand, I think particularly for our young people, they see in social media or in pop culture that LGBTQ people are more accepted and more visible, right? There are more characters on TV, there are more celebrities coming out. But then they come out and they discover that their high school principal is not, on the same Instagram channels that they are, or watching the same Netflix shows that they experience the same amount of homophobia or transphobia that many of us did when we were younger. And so that creates, that has an impact on folks' mental health. And so I think that's where again, I can't think of sort of a better word than paradox, right? There is this unprecedented acceptance that is followed up by both backlash and also pushback that can really impact particularly our young people who are being told that they don't understand who they are, that they shouldn't be allowed to sort of contaminate other young people or their friends. And that's a very harmful message. So that's the sort of strange dynamic that we're observing right now, and that I think contributes to so many of these disparities in not having access to school support, employment, all those other systems that we talked about a little bit earlier.
That sounds great, and your responses to my questions are perfect lead-ins to my subsequent questions. This is great. This is working out real well. So from a prevention science perspective, we often take a public health approach to viewing what contributes to mental health outcomes and behavioral health outcomes like substance use, and we think of things in terms, oftentimes in terms of risk factors that put people at greater risk for developing behavioral health or mental health outcomes. And then we have what we consider protective factors, things that can protect individuals from exposure to risk or moderate the effect of risk on outcomes. And so you mentioned a couple of risk factors societally and kind of broader and contextually kind of in our culture that place LGBTQ individuals or people who identify as LGBTQ at risk for behavioral mental health outcomes. What are some other salient risk factors that can occur either at the individual level, the peer level, the family level, the school context? What are some of the things that you're seeing?
Yeah, I really appreciate you bringing in that public health lens, right? Here at Trevor, we absolutely subscribe to that, and the framework and the language that we use to describe that is minority stress. And so we spend a lot of time talking about what minority stress can look like. And a big part of that is because we are still at a point, and it's a little sad that we still have to have this conversation in 2022, but we still have to say things like LGBTQ people are not inherently more mentally ill than straight or cisgender people, right? There is sort of that sense, especially among anti-LGBTQ advocates and politicians, that to be LGBTQ is inherently a mental illness, and that's why LGBTQ people are more prone to mental illness. However, that again, no empirical evidence to support that. What we find in almost all of our research is this concept of minority stress, right? This sense of the more marginalized identities you have, the more discrimination, harassment, othering, marginalization that you experience, that all accumulates in the form of stress, and that can all manifest in the form of mental health issues, including suicidality. We see that in our work when we look at folks within the LGBTQ community, right? We're very fortunate to have a very large survey sample, and we work very hard to make sure that that sample is racially and ethnically diverse. Still not quite as diverse as the United States of America. We have some work to do, but it is more diverse than a lot of other large samples. And so we find, right, like racial disparities within the community. And so again, we interpret that as increased minority stress of having two marginalized identities. We also observe that when we look at our young people who report having disabilities. And so for youth who are deaf or hard of hearing, or youth who are autistic, those folks also tend to have poorer mental health outcomes because of that increased minority stress. So then thinking about sort of non-identity factors that can increase that minority stress, I mean, the big one that we shared in our short brief about substance use, and so that I can say definitively has a relationship to substance use, is conversion therapy that I described a bit earlier, right? So we have, I can't remember the exact proportion of youth in our sample who have experienced conversion therapy, but that should be available on our survey website if folks are interested. But that's a big risk factor, right? And that was associated with significantly higher likelihood of regular substance use or substance misuse. Other factors that we see that have significant relationships specifically on sort of suicidality are, family support or even adult support. We have a previous study that found that having just at least one supportive adult in your life who sees you as an LGBTQ person and celebrates and affirms that is associated with 40% lower odds of suicide risk. An affirming school is also a big factor in a lot of our work. Living in an affirming home. Let's see, certainly experiences of discrimination or violence based on identity, whether that's your LGBTQ identity or your racial or ethnic identity, those tend to contribute to increased mental health risk. Sorry, those are just the ones that pop up on the top of my head, but it is all of these sort of environmental and social work, we would call them macro pieces, or even meso, right? Your family or your school, that's a small community, right? That sort of meso level community that you're a part of. Those all play a really important role, and can, unfortunately, when they are bad influences, can really increase suicide risk.
Mm-hmm. Great, thanks. Yeah, so you mentioned these risk and protective factors that can affect the likelihood that someone develops a mental or behavioral health problem. Now, what we do in prevention sciences, I'm sure you're aware, is to try to translate that basic research into preventive interventions, right? That we can help move the dial and affect the likelihood that one develops a mental health or behavioral health problem. Now, are you aware of any preventive interventions that have been specifically designed to promote the health and well-being of youth who identify as LGBTQ?
No, unfortunately, I am not aware of any specific. I can think of sort of small grassroots efforts, right? I can think of, here in Denver and in the Front Range area, we have a couple sort of mental health organizations that are by the LGBT community for the LGBTQ community, but I don't know if those have been assessed or evaluated in the way that like an evidence-based intervention would. And when I think about sort of evidence-based interventions, unfortunately, there are a lot of great ideas out there. There are a lot of folks sort of testing and evaluate different things. Years ago, when I was still in housing, I had colleagues who were evaluating a program that was host homes for LGBTQ youth experiencing homelessness. So sort of a like young adult foster care situation where established adults open their home to LGBTQ youth. Unfortunately, I didn't follow up with their work, so I don't know exactly sort of whether they found it to be impactful. So yes, unfortunately, those are a couple of sort of ideas that I've seen thrown around, but I don't know of any sort of official formal interventions that are out there.
Yeah, so that's clearly an area that we as a field need to do a better job at, right? And yeah, we've at the Prevention Center, we've done some kind of cursory scans of these evidence-based registries, or registries of evidence-based programs, and one of them is Blueprints, and there are others that are around the country. And we haven't been able to really find any that have been demonstrated to be effective for gender minority youth. At least there's the evidence isn't quite there yet. And so I don't know, maybe an opportunity for our two teams to work together moving forward here at the PRC and the Trevor Project. So let's say we're pretty confident that the evidence isn't out there for programs that are specifically developed for individuals who identify as LGBTQ. Another potential option could be to adapt existing evidence-based programs so that they are responsive to individuals who identify as LGBTQ. Now, one of the things that we're struggling with at the PRC is how to recommend best practices for adapting existing evidence-based prevention programs to be inclusive for LGBT young people. And it's really hard because, because these programs were not obviously developed with LGBTQ youth in mind. And so one of the things is we don't want to recommend making deep structural changes to existing evidence-based programs, because if you do that, then you don't know how it'll affect the effectiveness of a given evidence-based program. So we're kind of in a little bit of a catch-22 here at the Prevention Center. I'm kind of putting you on the spot here, I guess, but do you have any recommendations for how existing evidence-based programs can be adapted to be inclusive for LGBTQ youth and respond to the strengths and needs of youth identifying as LGBTQ?
Whew, that is
that was a big one.
Yeah. Yes, I'm very familiar with sort of the tension in implementation science, right? And it's certainly acute for LGBTQ youth, but also when we think about, interventions that were primarily tested among white young people and are now somebody's trying to implement them among communities of color. I think that's just a fundamental challenge, right, of evidence-based practice and culture, and trying to make it more culturally competent. I definitely don't have any sort of silver bullet. I would say the most effective interventions or sort of programs that I have seen that worked well with LGBTQ youth had LGBTQ youth in leadership positions. And so whether that's an advisory council or hiring LGBTQ youth staff, I was very fortunate. I had the opportunity to be a long-term volunteer at Rainbow Alley, which is the drop-in center for LGBTQ youth here in Denver, years ago. And what I really admired and what made being an adult volunteer there so powerful and fun, and why I thought the space sort of had this like magical quality that made young people want to come back, was because the young people ran the show. They were in charge. And I give credit to Nadine Bridges, who was the executive director at the time. She really understood how to support young people in leadership positions and then step out of the way. And so if an adult came in and had an idea for an activity for youth and thought like, oh, okay, like I want to do this activity with LGBTQ youth, they had to be interviewed by youth. And the youth would say, okay, yeah, we do want to do that program, or no, we're not interested. Thanks so much. Maybe we can change it, or, and that's challenging, right? Like young people are not, they're still learning, you know, they make mistakes, and they're interacting with their peers, right? So you have to have some conversations about boundaries and what that looks like. You have to have a pretty healthy community culture, but really that, you know, they ran the show, and so they had so much buy-in from their peers, and they had such supportive relationships with one another, that certainly when someone was experiencing a mental health crisis, you know, I as an adult was not the first person. It was usually a peer who would step in and have a conversation with them, and then I would be there supporting the peer, or if they needed sort of any sort of external adult support. But so that magic and power of a peer-to-peer connection with adult support, I think is something that can go a long way in terms of thinking about how we change programs, or how we implement programs or interventions with LGBTQ youth. I also think the fundamental challenge, you know, and this is, I guess I'd be curious to hear the Prevention Center's thoughts on this, is sort of like, in my mind and in my experience, it's just fundamentally harder to measure magic than it is to measure risk. Right? You know, when you're in that space, whether it's a classroom or a program or a summer camp that's really working, and where young people are getting along with one another and developing positive skills. I've been fortunate to work in a couple of those spaces. I've also worked in spaces that do not look like that, right? And I'm never quite sure how to capture that sort of magical, positive youth development in a survey or in an outcome measure. You certainly can, you know, things like social connectedness scales or things like that, and qualitative work can help us understand, you know, in people's own words, what the program or space means to them. But that's a challenge both at the Trevor Project and in my other work, right? It's so much easier to ask someone, how many times in the last year did you consider, you know, did you seriously consider suicide, than it is to say, how many times in the last year did your friends make you feel like you were an awesome human being? So that's, I think, a little bit of, us as researchers, we have some work to do in thinking about how to continue developing nuanced measures of these protective factors.
Yeah, measuring that magic. Ann Maston's ordinary magic construct, right? How do you measure those intangibles, right? And I think it has really important implications for replication of programs, right? Because sometimes maybe the evidence is based on, you know, this one trial that had that magic, right? And so how do you replicate that magic in subsequent trials and ensure that your program is going to be not only efficacious in that initial trial, but continues to be effective when implemented in the real world? And so I think that's a really good point. And unfortunately, I don't know that I have the answer for measuring magic, but I think that it's definitely something that's worth thinking about when wanting to replicate programs. So, you know, we've talked a lot about practitioners and prevention scientists and how they can support youth who identify as LGBTQ. You've done a lot of great work on with LGBTQ youth and surviving family rejection. So what role do you see, and again, you've alluded to this a little bit earlier, but what do you see, what role do you see in non-practitioners, including parents and peers, in playing a role in providing a context that is supportive for the positive social and emotional development of youth who identify as LGBTQ?
Oh, I love this question. Every time I get it, I get excited. I always come back to that 40% statistic that I mentioned earlier, right? That this finding that having just one or at least one supportive adult in your life can decrease, is associated with 40% decreased odds of suicide risk. What I love about that statistic, and what I tell journalists or media, anyone that I talk to, is that, to me, what that statistic shows is that being an ally matters, and that, like I said, I've worked in a lot of youth programming. I know what it's like to sort of have a short interaction with a young person, whether it's in a classroom or a summer camp or whatever, and you don't really know if they're listening to what you're saying, or if you're having an impact on them. And what that statistic and what our other findings about the support of adults, and specifically parents, families, teachers, shows that it is having an impact, and that being someone who makes young people feel affirmed in their identity is having potentially a life-saving impact on their mental health. And so when I think about how to break that down, right, how do we actually operationalize being an ally to LGBTQ young people, I actually am going to give a short plug for our May research brief, which is available on the trevorproject.org. We actually just did it on different supportive behaviors that parents and caregivers can do, and then their impact on mental health. And we found that pretty much all of the, I want to say like 12 or 13 different supportive actions that originally come from research from the Family Acceptance Project, which is also a great resource for folks to check out. Almost all of them were associated with better mental health outcomes among LGBTQ youth. And so those different actions were things like educating yourself on LGBTQ issues, being nice to your LGBTQ child's friends and or partners, right? So making sure your home is that welcoming space where folks can be comfortable. The other one that we hear really emphatically from our trans and non-binary youth over and over and over again is using their name and pronouns correctly. And so making sure that you're checking in with young people. Again, at Rainbow Alley, when we were working with lots and lots of young people, we would ask for people's pronouns pretty much every day, and we would share our own pronouns pretty much every day, because you never knew who might have changed their pronouns or might be trying a new one. And so particularly for young people, it's important to be checking in and asking them what is the best way to address them, and then making sure that we're making a good faith effort to use that. And folks understand mistakes happen. Changing pronouns can be challenging, but just good faith effort, making sure that you're correcting yourself and moving on if you do make a mistake. Let's see, other actions. Finding an LGBTQ affirming faith community was something that was important for some young people. Talking about LGBTQ issues sort of more broadly. So talking about some of these issues that are going on in the news, right? Asking young people how that makes them feel. Asking them what it's like to be an LGBTQ person at your church or your faith community or their school. And then making sure that you're prepared to support them if they're having challenges, right? So as adults, that's our role, right? Is to step in and talk to other adults, whether that's parents, other parents, teachers, principals, to advocate for young people. So yeah, unfortunately, I can't remember quite all of the actions, but I really encourage folks to check those out. But yeah, what it really boils down to, from the words of young people, is just sort of talking to them, taking their identities at face value, asking open-ended and non-judgmental questions if folks need more clarification, and then being available for conversation, and then just also treating them like normal young people. We get that response a lot too, sort of this sense of being affirming but not making a huge deal about it all the time, because they're also just kids, right? Like they want to hang out with their friends, they want to play video games, all of that kind of stuff. So helping them have that childhood that they deserve while making sure that they feel safe and supported in all aspects of their life.
Oh, that's great. Thank you so much for that. I've got one more question for you. We've got some really nice questions in the chat. Before we get to those questions in the chat, having discussed all of this, what do you feel are a couple of priorities or opportunities that you see for the future of the promotion of well-being and prevention of behavioral mental health issues among those individuals who are identifying as LGBTQ?
Ooh, yes. Let's see, I'd say my top priority currently is making sure that all young people have access to culturally competent mental health practitioners and services, right? So whether that's substance use recovery services. One of the most alarming findings from our 2022 national survey was that 60% of LGBTQ youth told us that they wanted some form of mental health treatment, but were not able to access it. And so that's alarming, to me, especially given the pandemic and sort of the larger cultural context that we're in right now. And so access, right? Making sure that we're folks don't necessarily need a ride or parental permission. Those are two big barriers that LGBT young people tell us prevent them from accessing mental health care. We also need our understanding of cultural competency to be multifaceted and intersectional. Our young people say they want an LGBTQ cultural competent counselor. They want to be able to talk about those things. They also want a counselor who understands that not all of the problems are because of being LGBTQ, right? That's another sort of facet that can be challenging for LGBTQ folks of all ages to access therapy. But they also need therapists who are understanding of their racial and cultural identities and the communities that they're coming from, or who are accessible, to their abilities or disabilities, right? So making sure that we have ASL interpretation, or folks who are familiar with working with folks on the spectrum, that young people are increasingly telling us all parts of my identity have to be included for me to feel safe in the space and for me to feel like that's an effective and healing space for me to be in. So that's probably my first priority. The second one, and this is certainly informed by my previous work on housing, is the housing crisis broadly in the United States, and then particularly when we think about young adults and LGBTQ youth, right? There are not enough shelters that are designed by and for young adults, and this issue that I talked about much earlier about young people in Philadelphia not feeling safe in adult shelters, that's still an issue pretty much everywhere. So making sure we have services that are available, making sure that we have, actual affordable housing for folks to move into, making sure that it's low barrier housing too. And I think this is where the substance use piece, substance use and housing instability are so intertwined for so many young people. In many ways, using substances is a coping mechanism for the stress of living outside, right? And it's a very understandable coping mechanism. And so, it can be very, very difficult to both be in recovery and get back into housing. And so making sure that we are both supporting folks' recovery goals and getting them low barrier housing where once they're housed, they can start working on some of those sort of higher order needs or mental health challenges. Let's see, so that would be my second priority. Third priority, I think this is something that, again, sort of ties back to my dissertation. I would love for the LGBTQ movement to do more work with families and parents of LGBTQ young people. Coming back to the Family Acceptance Project, which is a research organization out in San Francisco State, they have done a lot of really great work illuminating the fact that for a lot of parents who may exhibit rejecting behavior towards their child, some of those folks are just sort of dyed-in-the-wool, homophobic, transphobic. It could be due to their faith. It could be due to their political beliefs. It could be not connected to those at all. Those folks we may not be able to change in a timely manner, maybe someday. But there are also a lot of families who don't hold those sort of deep-seated bigoted beliefs, but are just scared. Right? They grew up in a culture or a time when being an LGBTQ person was very difficult and scary and hard. And so when they think about their child being LGBTQ, they think their child's future is scary and hard. And that's why they sort of exhibit these rejecting behaviors as a way of sort of trying to convince or nudge their child to not be LGBTQ. And those folks, I think we can change. I think more education about, it is not all scary and hard. There are certainly challenges, but there is also much joy. And particularly for young people, I think showing both young people and their families like, hi, hello, trans adults exist. We are happy, we are healthy, we are loved by our families, by partners, by our friends. This does not have to be this scary future of rejection and discrimination for your entire life. So I would love to do a little bit more work with those families who just need a little bit more education about what their child's life could look like.
Mm-hmm. That's great. I think back to the history of prevention science here and how we oftentimes come from a deficit model that we need to prevent bad things from happening all the time. But it's not always about preventing the bad from happening. It's about promoting positive development and acceptance and well-being. And so we definitely need to play that role in our field. So thank you, Jonah. I really want to turn over the conversation to the Q&A in the chat here. And I've got a few questions, and keep them rolling in. If we can't answer them in the next 10 minutes or so, we can definitely follow up with you. But a couple of the questions that we have for you, Jonah, are really around resources and being able to access some content. So one of them is that Beth is really interested in the LGBTQ 101 that you mentioned early on in the webcast. Where can you find the link to that? If you're able, I know it's can be challenging to multitask and answer questions while you're typing in that chat. But if there's a link that you could maybe, if not verbally point someone towards, maybe typing it in the chat or both.
Yes, let's see. Sorry, I don't have access to the chat, unfortunately, so I can't answer it there. But I would say going to our website, trevorproject.org. I don't know the exact process for signing up for one of our trainings, but I know that the training team has a page on our website. I don't know if we do sort of general open trainings or if you have to be affiliated with an organization. I am not quite sure about that, but I do know that our training team is fabulous, and if you reach out, they will be able to get back to you. I also know that there are some local organizations, and I don't know where Beth is located, but there are other places where LGBTQ 101 training is available. So, I mean, the first place that popped into my mind is the Pride Resource Center on CSU's campus, has a fabulous safe space training that is more sort of campus oriented, I think, but would give a really strong 101. I don't know if they're still doing that virtually. They definitely were during the pandemic, but I would encourage you to reach out to them. And then other sort of the LGBTQ Center of Colorado, I don't know if they do sort of 101 trainings, but they may be able to also provide more sort of reference. There are a lot of consultants out there that do this kind of work, so there are definitely opportunities to get that kind of training. I also think, and social media is a double-edged sword in our society, right? There's good and there's bad, but there are a lot of folks out there creating LGBTQ content on places like TikTok or YouTube, and so I would definitely vet the person, right? I would sort of make sure that how do you vet someone on social media? I'm not totally sure, but seeing if they're recommended by other sort of blogs or websites or community resources. But there is definitely a lot of content out there that you can access. But yes, absolutely. Please go to our website, trevorproject.org.
Great. And then relatedly, Amanda's wondering, on your website, do you also have maybe one-pagers or fact sheets or things like that on numbers, maybe the health disparities or the numbers of basically the statistics and those kind of things?
Yes, absolutely. That's a great question. So yes, if you go to our website, we have a research section, and that contains more statistical related resources. So like I said, we do a monthly brief. That's usually 1 to 2 pages, 2 to 3 pages. It's usually on topic, right? So deaf young people, autistic young people. We also, once a financial quarter, put out a larger report that tends to be anywhere from 20 to 30 pages, It's not peer reviewed, it is sort of self-published, but that's a deeper dive into each of those topics. So let's see, our last report was specifically on Asian American and Pacific Islander youth. It's unique and exciting because it's one of the first pieces of research to break down the Asian Pacific Islander category into, you know, folks who are Vietnamese or Chinese or Filipino, and look at some of those differences within that large and diverse category. We also had one on homelessness and housing instability that might be particularly relevant for folks on this call. So those are all on our research page. I also should have mentioned in response to the previous question that we have a resource center on our website as well.
Oops. It looks like Jonah might be frozen on my page. While hopefully he'll be able to become unfrozen in a second. But one of the things that I'll mention about some of the resources, or a resource that the prevention research is going to provide here, hopefully within the next month, is that we've been developing research to practice tools around program fidelity of implementation for programs, and then how to adapt according to best practices those programs when implementation challenges inevitably occur. And Jonah and I had talked earlier on about the challenges related to adapting evidence-based programs to be inclusive and welcoming and supportive for youth who identify as LGBTQ. And so we are in the process of doing that, and we have a page on our website that is titled Implementation Toolbox. And hopefully within the next month, you'll be able to find that resource for your communities to use as you're implementing evidence-based programs, or even best practices, evidence-informed programs in your communities. So we've got about 5 more minutes and a couple of really good questions. So let's see here, I'll publish this one we've got from Anonymous. And let me know, Jonah, if you feel like you've already sufficiently described this or covered this one. This one is, says, wait, I just lost it. Right. What are some common barriers to accessing LGBTQ youth or making them aware of your available resources?
Oh, that's a good question. Apologies for my technological interruption. Let's see, how to reach out to LGBTQ youth. Again, this is an area where I think LGBTQ youth, if you can hire some LGBTQ youth to help advise you, whether formally or informally, they are probably your best resource as I quickly discover that I'm no longer a youth. But I mean, social media is really the place, especially we are a 100% remote organization now as the Trevor Project. And we, unfortunately, I would love to see us do more of this in the future, but we don't currently work directly a lot with youth as a research team, at least. We certainly are. Our crisis teams are talking directly to young people, but they're not having conversations about our research. And actually, when we recruit young people for our survey, we don't use any sort of Trevor branding because we don't want folks to sort of bring whatever positive or negative perceptions they have of Trevor into their survey responses. So when we recruit young people for the survey, we work with a marketing company. And we do a lot of targeted ads on social media, primarily Facebook and Instagram. I would love to see us sort of branch out to like TikTok or Discord or other platforms. I think there's not as many young people on Facebook these days, and even Instagram, I think. But those are spaces nonetheless where folks are finding each other. And so I think if you're able to connect with, you know, folks who are sort of using LGBTQ related hashtags, or I'm not on TikTok, but you can like duet with other people. So folks who are sort of using one person's video to create their own content and having conversations about LGBTQ issues. I think those are the folks that young people are really plugged into. And so if you can connect with them, hopefully you can also connect with young people.
Thank you. Okay, and last question, and then we'll respond to. There's one question that we can respond to after the prevention extension cast. Really quickly, if possible, do you know how effective mentoring programs have been for LGBTQ plus youth in preventing suicidality, both from the mentor side and the mentee side?
Oh, that's a great question. Unfortunately, I'm going to have to say I don't know. I am not quite as familiar with that literature. Would love to see more work. And actually, I'm trying to remember the name. I'm not going to remember his last name, but Christian, and I'll try to find the last name, is a scholar who does study mentoring, and I know is pretty active in LGBTQ youth spaces and has partnered with Big Brothers Big Sisters of America to try and learn a little bit more about what that mentoring relationship can look like. So maybe try Googling Christian mentoring Big Brothers Big Sisters to try and find his work. But that's who I would defer to on that very great question.
All right. Well, Jonah, thank you so much for joining us today. That's all the time we have to talk about this for a lot longer, but got to go. And I just wanted to thank you for your time, and thanks everybody in the audience for joining. You'll be able to find this episode in a couple of days of the Prevention Extension Cast on our website, and we'll send you all the link for that. We will have our next Prevention Extension Cast in a couple months. And until then, everybody take care. Thank you all again.